Thank you very much for that introduction, David. It's a real pleasure to be back again on Building Strength webinars. And I always get some tremendous feedback from our listeners. Well, when I first told you that I would do a webinar on what, on an anti-aging medicine practice, what is anti-aging, I was very enthusiastic about it. But when I got into the nuts and bolts of preparing for the webinar, I realized that I really had picked a topic that was so huge that I realized I had to scale it back a bit, and I'm going to hit some major points. And as you said in your introduction, David, this is not meant as medical advice, but what I do hope to do is get people to think about what would be the benefit for them in whatever city they live in, to seeking out and utilizing a functional medicine doctor, a doctor who is involved in longevity support, which is also called anti-aging. Now, I really don't like that term because, of course, we're going to age, but we want to age healthy. And so I like to look at it as longevity support. So I'm going to touch on some of the highlights because each one of these topics could actually be a webinar all on their own. Now, my background is that I'm board certified in internal medicine, and I am a member of the American Academy of Anti-Aging and Regenerative Medicine. That's a long title, but it's basically doctors that recognize that we can work with the body to support healthy aging and vitality. So by anti-aging, we mean longevity support. Anything that in the body that has started to degenerate, we're looking at ways to have it undergo regeneration. We're trying to reverse the damaging effects of long living, tough living, exposure to toxins, etc., and also halting any ongoing harmful practices, harmful processes in the body. And most doctors do, as I do, they combine therapeutics, conventional and alternative. There's no reason to throw out the baby with the bathwater. And what I strongly preserve from my background in conventional medicine is a very scientific approach, whether it's alternative or conventional. And I don't even like the word alternative because alternative is now being so incorporated into everyday medicine that it's starting to be a misnomer. So I would, put it in the category of things that work with your body as opposed to just slapping drugs on symptoms. And we call this now functional medicine. In other words, we're looking at the function of the body and the overall optimal functioning of the organism and trying to support that in any way we can that has good long-term outcomes. We're looking for long-term outcomes and not just handling a symptom for right now. So we have the goal of reducing risk, risks of impairment and debility and ultimately death from a variety of things: obesity, heart disease, stroke and cancer, diabetes. These are among the top factors that contribute to mortality and morbidity in this country. Some people may live a long time, but they spend their last 20 years in various stages of dementia. So again, we're looking at quality long life, not just keeping the body going, even in the face of something devastating like dementia. We're looking at reducing the risk for dementia, fractures, blindness, organ failure. So it's all about reducing risks as well as reversing processes that have already started down this path. And the goal, again, is a high-quality, long life. Now, I got an amazing statistic from an insurance agent whose company has an actuary, and these are people who are professional number crunchers when it comes to things like longevity and illness, because they're trying to come up with, well, what's an insurance risk for a particular age of American population. And what he said is the actuary had told him that although Americans are definitely living longer, they're not living longer independently. So here we are living longer, but if our last, if our added years that we have are being spent completely under the care of our adult children or in an assisted living center or in a nursing home, that's not really considered the best quality of life. So we're talking about a high quality long life, not just keeping the organism going. We want people to go into middle and older age with vitality, with stamina, with strength and with independent mobility. We want them to have intact vision, a sharp mind, and ultimately to be happy. And of course, it's hard to be happy if you're constantly struggling with a failing body. So we do combine these conventional and alternative therapeutics, and I'm sorry that I have a slide missing here. On our principles, we really work with the body's innate and regenerative mechanisms to improve health by actually addressing the cause of the symptoms and not just slapping drugs on the signs or the symptoms. So we look at what's going on with joint pain. Is there an underlying inflammatory condition, an allergy, a toxin, something that we can actually treat behind the scenes? What's going on with low energy? Instead of just giving a pep-up pill, why don't we treat the cause of the low energy? Same thing with weight gain. The current theories are really pointing to weight gain being an inflammatory response. Of course, the toxins are preferentially held in the body, in fat. And the body holds onto the fat because the fat's holding the toxins to keep those toxins from spreading to the rest of the body. So as long as somebody is burdened with toxins, they're not going to be likely to let go of the fat. So again, this is just an example of what we're looking at. Instead of just giving somebody an appetite suppressant for undesired weight, we're looking at, well, what's behind the weight gain? Loss of muscle mass, medically that's called sarcopenia. We look at, well, what's behind that? And in many people, it's a deficit of their hormones. Digestive problems. I have yet to see somebody in my practice that has totally perfect tests regarding their digestive system, and it's a rare person on the modern diet who does not need some sort of probiotic support. Skin changes is a hallmark of aging, and definitely there's many things that can be done to reverse skin damaging effects of aging and improve where somebody is from where they are right now. And also there's a lot that can be done to reverse and retard mental decline. So the differences from a strictly conventional practice is our emphasis in functional medicine and longevity support is on prevention with very specific interventions and not just preaching. And I'll give some examples of that as we go on. So whereas the usual medical doctor will say, you know, you really ought to quit smoking and you ought to lose some weight and you ought not to eat that donut for breakfast, he doesn't give you anything else besides the preaching to help you effect those changes. And in functional medicine, we're talking about a whole lifestyle change. So we really embrace an entire wellness philosophy instead of just preaching about it. One remarkable thing is that while Americans generally are living longer, it turns out that, as it has been historical, physicians tend to have a premature death rate compared to the general population. And one thing I would advise people to look for in choosing a physician is look for somebody who walks the talk, who themselves is an example of what they're advising people to do. So one of the other differences is that we use pro-life therapeutics. So you hear this word antibiotic or anti-cancer, anti-this, anti-that. For instance, conventional chemotherapy drugs are getting at killing the cells, which is great. I want to kill cancer cells too, but we also have to support the body's normal immune function. We also have to give that person some way to detoxify safely. So we also have to give them nutritional support so that their immune system is going to turn around and be able to fight cancer cells and surveil, have the cells undergo surveillance and be correctly eliminated naturally by the body. The theory is that every day perfectly healthy people are producing cells that look just like cancer cells in our body, but since our immune systems are intact, we're getting rid of those, sequestering them and eliminating them or forbidding them from reproducing because we have an intact immune system. So we definitely want to support that in somebody who has risk factors for cancer. Whereas your conventional treatment of cancer is just at getting at killing those cancer cells. The functional medicine doctor looks at a much broader picture. So we target underlying problems, as I've said. And the main thing is that we're willing to think outside of the box while remaining firmly rooted in science. A lot of functional medicine doctors, however, are not content to wait until the drug companies figure out how to get something from the stage of discovering something in the Amazon forest all the way through FDA studies paid for by a drug company before we're willing to try certain therapeutics, particularly the natural ones. And your functional medicine doctor should also be chosen with an eye toward, does this person ascribe to the Hippocratic Oath? Now, if you've watched some of my other webinars, you know that I've given some background in the past on the Hippocratic Oath, and it's not something that's actually routinely sworn to at medical school graduations anymore. And although it doesn't contain the phrase, first do no harm, it does say it is a pledge toward not treating the person with something that's toxic. Well, that's hard to do in this day and age of all our pharmaceutical armamentarium, all the drugs we could possibly give, whose side effects are listed in sometimes 50 and 60-page, package inserts. But as much as possible, you should look for a physician who's looking at working with your body instead of against it, and absolutely minimizing any adverse effects of treatment. So let's go over a few of the most popular theories of aging. These are not by far all of the theories, but these are some of the most the ones that are really being looked at most closely today. And one is just the wear and tear theory, that your body loses its ability to repair as it ages. And then there's a related one of neuroendocrine decline. And we have neurotransmitters, the chemicals that facilitate the transmission of the electrical impulse from cell to cell. And we also have hormones. That's the endocrine system, and these are chemical messengers that help organs actually get the body tissues to work as they're supposed to. And a functioning neuroendocrine system is essential for optimal health. And we find that the decline over the ages of losing hormones and losing effective neurotransmitter function is something that is the process of aging. That is why most functional medicine doctors have as one of their priorities adjusting the hormones. Again, not in a pharmaceutical way, but more in a way that works with what's natural to the body, and that's bioidentical hormones. Another theory is free radical damage, very much related to the wear and tear theory, where there's just so many toxins that are carrying an extra electron, that's a negative charge, that it overcomes the ability of the body to continue to handle that on a moment-to-moment basis. And these free radicals, you can think of it as a shiny piece of metal that gets exposed to the elements and eventually gets rusty. That's the action of free radicals. So in our body, the equivalent of buildup of rust would be like hardening of the arteries, poor detoxification capacity of our livers, poor skin consistency, loss of muscle mass, the bones not repairing as well, not bouncing back from infection as well. And these can all be signs of free radical damage. And then there's a theory called the Hayflick limit, named after the person who theorized this and promoted this theory, and that is that you're born with only so much ability for your cells to divide and reproduce. And once you've reached that inborn limit, you conk off. Sort of similar to an earlier theory of you're born with only so many heartbeats, and once you've expended those heartbeats, it's your time to go. So if you look, these all have something in common, and we do find that although there are genetic components to how long somebody could possibly live, that even things that are genetic tendencies can be tremendously influenced by our lifestyle and our habits and our activity and our nutritional intake. So genes are not as hardwired as we once thought. So let's take a look at what the U.S. Public Health Service has identified as the top lifestyle-associated causes of death. So these are things that the person's habits and routines are promoting the main things that would cause death. And of course, smoking is way up there. I'm not even going to say anything more about smoking, okay? Quit smoking. Anybody that's interested in living longer or anti-aging, you've got to quit smoking. High blood pressure, overweight, being sedentary, having a high blood sugar, increased LDL cholesterol, which is the small particle damaging cholesterol. And interestingly, all of these are directly or indirectly toxin related in some way, and I'll describe that a little bit more. So I want to take these main risk factors and go over them one by one. And first we'll take high blood pressure. We know that people that have high blood pressure have a greater than normal response to oxidative stress. But even though they have a greater than normal response, their actual function is impaired. So it's almost like the greater than normal response to the toxins affecting us still cannot overcome the poor function that people with high blood pressure have in dealing with oxidative stress. So oxidative stress are these things that are going to build up the rust, like I said. The extra negative charge particle is a free radical, and that causes lots of damage at the cell wall level and at the molecular interchange level. So you have a toxin, and that promotes free radical formation, and that acts directly on the endothelial cells. Now, the endothelial cells make up the vessels all throughout the body. And that, in turn, prevents the release of nitric oxide. Well, nitric oxide is the chemical that causes relaxation of the vessel to lower the blood pressure. So when you have a toxin that's generating a free radical that acts directly on the cells to prevent the release of nitric oxide, you're not going to have relaxation of the vessel. So again, very much toxin related. So to improve blood pressure, I'm sorry my arrows somehow did not show up on these slides. You know, the usual medical doctor will give you some medications, and indeed I have to use medications on some people, but I never let them go out the door. But I'm not also giving them something to eventually come off the medications or to make the medications work better, and a great deal of people can be treated non-pharmacologically altogether. But we know that if we lower the blood pressure, then we can have a 60% less chance of stroke in that person. We know if we lower the blood pressure, we can have a 53% less heart disease. So more than half their risk of stroke and heart attack just by lowering blood pressure. So the conventional advice to lower blood pressure is, look, lose weight, eat healthy, exercise, and reduce your salt. And that really is it, and here's your prescription. But a functional medicine doctor would add much, much more than that. They would recommend polyunsaturated fatty acids. We know that the omega-3s improve insulin receptor sensitivity. We know that they definitely help the body work with the toxins, and they can help the antioxidants work better. We know that omega-6s counter the effects of saturated fat. And the ideal is to have a ratio of omega-3s to omega-6s at least of 1 to 1. A lot of people have too much omega-6s compared to omega-3s. We do want them to be either balanced or slightly more omega-3s. We also recommend monounsaturated fatty acids. That would be like olive oil, and that improves the endothelial function. Again, that's the cells that are composing, that the vessels all throughout the body are composed of. And they actually cause a dilation or an enlargement or relaxation of the blood vessels. So we definitely want to recommend the essential oils. We also recommend fiber. A high protein diet has definitely been associated with lowering the blood pressure, and high calcium in the diet. And interestingly, giving somebody a calcium supplement to bump their calcium level does not have near the beneficial effect on blood pressure than simply a high calcium diet has. We also recommend that people keep their potassium to sodium ratio at about 5 to 1. And like the calcium, just giving somebody a potassium supplement does not seem to affect the blood pressure. But if in their foods they can have the preferred potassium to sodium ratio, we do see an effect on the blood pressure. We also recommend some seaweed. One thing back on potassium that I wanted to mention is that high potassium does correlate with the decreased risk of cardiovascular disease and stroke independent of the blood pressure. In other words, even in people who run a high blood pressure, if we can keep the potassium to sodium ratio preferable, they overall have a decreased risk of stroke and heart attack. So even though it doesn't directly lower the blood pressure. Let's see. Potassium is found in leafy greens, dark leafy greens. We're not talking head lettuce here. We also recommend that people take vitamins, vitamin C, vitamin D, B6, the lycopenes, which are from tomatoes mostly, CoQ10. Definitely helps the heart directly and also helps the blood vessels, and magnesium supplementation. Unlike calcium, where external or additional supplementation doesn't really matter, what you have to get your calcium from is food, with magnesium we do find that actually taking magnesium supplements has a direct effect on blood pressure. And it used to be an old-timey remedy for high blood pressure in emergencies before we had a lot of drugs. And it's still used today as an emergency treatment for pregnant women who have high blood pressure. So magnesium, we're looking at least 1,000 milligrams a day in a form that's absorbable. And calcium in your diet, we'd like you to at least get 800 milligrams a day. And like I said, the dark leafy greens. The other thing that really helps is alpha-lipoic acid. Arginine, which is an amino acid, it's a nitric oxide precursor. So anything we could do to increase that nitrous oxide is definitely good. Taurine is another amino acid that in high doses can be very beneficial for people with high blood pressure. The element zinc can be good, and you don't really have to take that much zinc to have an effect on the blood pressure. Celery's good. Now, unless you're really into celery and you're willing to eat 8 stalks a day, you're going to have to go with celery juice. Pycnogenol from pine bark is very effective for lowering blood pressure, as is garlic extract. So the garlic, we're talking, the extract is called allicin, and you want to take at least 10,000 units of allicin per day. Now, you would have to ingest 4 garlic cloves to get that much, so I definitely recommend the extract instead of walking around with all that garlic. So that just gives you an idea of what your functional medicine doctor would be doing to lower blood pressure, whether or not you also had to take some conventional medications permanently or temporarily. Certainly lowering your blood pressure will reduce your risk factors overall. Now, another risk factor is being overweight, and we know that calorie restriction induces a gene called the SIRT1 gene, the SIRT1 gene, and this gene has direct anti-aging effects. It somehow regulates gene expression to extend life. And we've known for a long time that people that are on slight calorie restriction for their whole life do tend to live longer. You don't tend to see morbidly obese people living to their 90s, but you see plenty of skinny people living that far. Funny enough, the action of the SIRT1 gene does not correlate with your resting energy expenditure. In other words, it's not like it slows down the metabolism or anything. So we're not really sure all of the intermediary steps of how it works, but we do know that activation of this gene promotes longevity. Now, regarding being overweight, I love this 7-word mantra from Michael Pollan. He says, eat food, not a lot, mostly plants. And then he spends the rest of his books describing what he means by food. And his #1 hint is, it doesn't come in a package. So you've really got to look at what's marketed to us these days as food. And if you just stick to the perimeter of the grocery store, your fresh fruits and vegetables, maybe some meat and fish, go along that aisle in the back of the store, and then maybe some dairy and some frozen things, then you can get out of there with a pretty good healthy basket of food, but the minute you start going down the aisles and you get the things that are in packages, and another hint aside from coming in packages, that if you cannot pronounce the ingredient, it's probably not that good for you. So there are tons of natural weight loss aids. And like I said earlier, there's hardly anybody in my practice, and I go strictly by testing. I actually look at their gut function. There's hardly anybody who can't benefit from the addition of some probiotics. And there's a variety of different probiotics, and one that has gotten attention recently is one that actually comes from plants, Lactobacillus plantarum. And it's available in various forms. You can get it in capsules, you can make goat milk kefir out of it, you can make your own organic raw refrigerated sauerkraut. But probiotics in general are very supportive for weight loss. Green tea extract, the active ingredient for losing weight for green tea is called ECGC. And if you really are going to just drink green tea, you'd probably have to have about 60 cups of it a day to get the amount that you can get in an extract. So I definitely recommend the supplements. There was one study that showed that 600 milligrams per day of ECGC, over 4 weeks, the people lost 4.6% of their weight. So between 4 to 5% of body weight was lost in just a month. And if you look at starting body weights of, let's say, 200 pounds, that's a significant weight loss in just a month. Vanadil sulfate, there was one study that looked at taking 7.5 milligrams with every meal, and it was found that it seemed to mimic the action of insulin, and actually allows the body to utilize the food that's coming in and gets it into the cells where it can be used as energy. White kidney bean extract and Ervingia are both carb blockers, natural carb blockers. There was one study on the white kidney bean extract where they used 445 milligrams and had the person take 2 to 3 with every meal. It seems like a lot of tablets and a lot of pills, but remember, these are food supplements, and you can't really think of them as pharmacologic agents. And what it was found is that it seems to inhibit the amylase enzyme so that carbs don't get converted directly into sugar. It slows down the carb metabolism. And one study showed that in 8 weeks people lost around 4 pounds. So I'm talking about each supplement in its own separate study, but when you add these together, you're talking about a significant weight loss per week and per month. 17 keto DHEA, 100 milligrams with breakfast and 100 milligrams with lunch, was shown to induce an enzyme down at the mitochondrial level. Now, the mitochondria is the subunit inside a cell that's the powerhouse that actually generates water and energy. And when these mitochondria were activated in the liver by 17 keto DHEA, it drives the liver to burn fatty acids. This is taking solid fat and converting it into a fatty acid form where it can be eliminated by the body. One study showed in 60 days people lost 6.3 pounds, and that's just on the 17 keto DHEA without any of these other weight loss aids. Fucoxanthin is an interesting one. It's a seaweed carotenoid. Now, you may recognize that word carotenoid. That's sort of a pro-vitamin A. And this is found in a lot of green and yellow and orange vegetables. But this is from a seaweed source, and it too activates an enzyme in the mitochondria of the cells, and it has been found to actually increase the metabolic rate. It induces fat burning, and it blocks the development of new fat cells. One study showed that in 16 weeks on this supplement in combination with pomegranate seed extract, people lost 15 pounds, so that's nearly a pound a week. Let's see, I'll go back on that. I hadn't talked about Ervingia. It's also a carb blocker. It inhibits the glucose from turning into fat, and 100 milligrams twice a day was studied and found to really help with leptin resistance. And leptin is this hormone that's found in the fat. Although this effect wasn't seen until people had already been on it for 2 or 3 months. Once that leptin aspect gets handled, however, it really takes care of the person's sense of satiety. In other words, they're feeling that they're full, that they've had enough. A lot of people who are overweight or obese have a hard time with calorie restriction or portion reduction because they eat what they're assigned and then they go, I'm starving. I could eat a hamburger and fries right now. And we find with this Ervingia that after 8 to 10 weeks, it sort of resets their sense of satiety. In other words, how full they feel after what thin people would consider a normal meal. And they come much more in line with the satiety factor or the fullness feeling that a thin person has. One study followed people on this herb alone, and they found that in 10 weeks people lost nearly 8 pounds. So again, that's studying this supplement alone. And the way this is used is after a person is at or near their goal, they go down to a lower dose of it and they're maintained on it once a day or every other day. Other natural weight loss aids, especially for people who crave carbohydrates right before they go to bed, 2 to 3 grams of vitamin C right before bed, some lecithin, some omega-3 fatty acids, and some people actually would benefit from some genetic testing. We do find that there's 5 specific genetic factors that we can test for that give us some guidance as to whether this person would do better on a complex carbohydrate diet or whether they should be on a high protein diet, or with this person's particular genetic makeup, if exercise is going to be a greater bang for the buck in terms of weight loss than specific calorie restriction. So for some people, especially people who've been on diet after diet and haven't had success, I'll even start off with some specific genetic testing to give us some guidance. Now another risk factor is high glucose. Now the conventional doctor says, well, you know, knock off fat and sweets, and then they sit back and wait for diabetes to develop. And the doctor saying that himself might be overweight and having a coffee and donut for breakfast. Whereas the functional medicine doctor really looks at what we can do to work with the body's own mechanisms to help the person lower their blood sugar. The first thing is soluble fiber. There's 2 kinds of fiber, soluble and insoluble. And the soluble fiber is what really helps with the sugar metabolism. So sources of this can be oats, soy, pectin, guar gum. Now, of course, there's carbohydrates and fats and things that can come along with these. However, there are soluble fiber extracts of these plants, and a person can get plenty of soluble fiber by that. For instance, the soluble fiber from oats is called beta-glucan, and that can be bought as a supplement in the health food store. Of course, we recommend that you only consume foods that have a low glycemic index. Now, this is just a scoring system where the food you're eating is compared to liquid sugar. And if you took some liquid glucose and you look at how much your sugar goes up over the next 2 hours, that's what your food is compared to. So if liquid glucose gets a score of 100 and a white potato gets a GI score of 95, that means that white potato is not that far off from just liquid sugar in terms of the response that your body has with it turning right into sugar. So you look for low glycemic index foods, and lists of these can be found abundantly on the internet. But what popularized looking at this was Dr. Bernstein's book on diabetes and also the Sugar Busters book. It's still a staple in handling people with high blood sugar. Unfortunately, most of the dietitians in the offices of diabetes physicians are still saying to people that they can eat white rice and they can eat white bread, and unfortunately this very fundamental thing of consuming low glycemic index foods still hasn't reached the conventional medicine doctors to a large extent. Omega-3 fish oil, again, we see that show up. I'm sorry my slide left something off. It's with EPA and DHA, it's supposed to say. In other words, the 2 components of the omega-3s, we want to find both of them help lower the blood sugar. Conjugated linoleic acid, something that's available at all health food stores, also helps lower the blood sugar. Resveratrol is an interesting one. Resveratrol is something that's found in the skins of red grapes, and it is the ingredient in red wine that has an anti-aging effect. And I talked earlier about how calorie reduction induces the SIRT1 gene, the SIRT1 gene, which regulates an anti-aging effect. And if somebody takes resveratrol, it mimics calorie reduction, even if a person doesn't reduce calories. It has that effect on longevity. There have been studies where they've given this to rats or mice. I'm not sure which it was. Funny enough, rats are actually closer to the human body in how they metabolize things than mice are. I'm not sure what that says about our character. But a study on rodents with resveratrol showed that even obese rodents lived longer when they were taking resveratrol, even if they didn't have calorie reduction. They lived just as long as the people who had calorie reduction. So there's something about this red grape skin extract that mimics the effect of calorie reduction. It may be this business of helping to control the blood sugar. And then olive oil too, a monounsaturated fatty acid, can help control the blood sugar. Now again, I'm not here to give specific advice, but I'll just throw out some numbers here. The omega-3s, we want over 2 grams a day. That's quite a bit. The conjugated linoleic, 240 milligrams a day. The soy protein, you can take up to 25 grams a day. We know that soy fiber not only decreases the glucose, but decreases the cholesterol. And I don't have specific slides on handling the LDL cholesterol, but everything I'm saying regarding low blood pressure, handling overweight, and handling the blood sugar is also going to be lowering the cholesterol. Alpha lipoic acid, the general doses that we use are 1,200 milligrams a day. It's interesting. Alpha lipoic acid is a sulfur-containing fatty acid, so it's fat-soluble and it's water-soluble, and that's a very unique characteristic, and that allows it to enhance the body's transport of glucose and to get it utilized so it yields energy, rather than just have it sit around and do damage in the various organs. And it also, alpha lipoic acid actually recycles the body's vitamin C and vitamin E, and these are very powerful antioxidants. So alpha lipoic acid is a supplement that I have people on for many different reasons and helps them all across the board. You see chromium on here. It counteracts glycation, and glycation is the thing about blood sugar that actually causes hardening of the arteries, and chromium counteracts that. Some people swear that chromium also decreases their sweet craving. DHEA is good. Vanadium is good. Vanadium is an earth element. The antioxidants vitamins A, C, and E are good. Garlic extract not only helps with the blood pressure, it helps with the blood sugar. Ginseng extract has been shown to help. Turmeric is good. Cinnamon extract. If you took enough cinnamon to lower your blood sugar, you would also be ingesting so much cinnamon oil that it wouldn't be good for you. So for cinnamon, you really have to take the extract. And the active ingredient in cinnamon is called cinsulin, C-I-N-S-U-L-I-N. And taking 250 milligrams twice a day, but all the way up to 3 grams a day. Again, you cannot possibly take that much cinnamon. First of all, you'd get sick and tired of the taste of cinnamon. But you'd be ingesting so much oil along with it, it would not really be good for you. So we do recommend the cinsulin extract. Maitake mushroom has been shown to be helpful. Green tea extract, 400 milligrams. Green coffee is also good. Pomegranate extract, the active ingredient there is ellagic acid. And here's the vitamins I was talking about, and in addition to just a general B complex, for people who are trying to lower the blood sugar, I recommend extra B6 and B12, as well as a cofactor, CoQ10. We find that B6 metabolizes protein, fat, and carbohydrates, so no matter what you're ingesting, it's going to promote the metabolism of all three. And vitamin B6 is also needed in order for the body to make insulin and to make epinephrine. It's needed to make hemoglobin, which carries the oxygen in our red blood cells. And vitamin B6 also treats homocystinuria, so that is the high homocysteine levels that are associated with premature cardiac death and stroke death. Vitamin B6 itself is also an immune enhancer. We do recommend vitamin D, and these days most people need at least 5,000 IUs, but that's good to follow with blood tests so we could see exactly how much to give you. And CoQ10 for lowering the blood sugar in doses of 120 to 200 milligrams a day. Some minerals, vanadium as I mentioned before, selenium. Now selenium is found in the soil, and it used to be common in our breads, in our bakery supplies. But because the soils are so depleted, unless your bread is made from wheat that was grown in North Dakota, in this country, you do not have enough selenium naturally in your diet. Now selenium is also one of those minerals that you can overdo. So too low is bad and too high is bad. This is something I really recommend people get test results on to make sure they're staying within a good range. But most people need 100 to 200 micrograms of selenium per day. Some zinc, magnesium as I mentioned, some chromium, and also the amino acids, N-acetylcysteine and arginine. So and arginine here for lowering the blood sugar, we're talking fairly high doses, 4 to 9 grams a day. So another risk factor is the sedentary lifestyle. And the difficulty with most people is they've tried to exercise and they've gotten injured, or they started too much too fast and got exhausted or couldn't keep it up. So the first thing I recommend for people is they've got to develop the habit of getting off the couch. So I recommend everybody start just with walking. Not in order to try to get the heart rate up or in order to strengthen your muscles, but just to develop a habit of getting out of the house at a certain time every day, getting the athletic shoes on, and just taking a walk. And preferably in a place where there's people, dogs, pets, beautiful trees, you know, someplace where you could look far, even if you're in the middle of New York City. Go out and get stuff to look at, but just get the habit of going out at a certain time every day. It will lower your blood pressure and you'll feel better before you've lost any weight. However, I am not big on recommending exercise programs when people first come to me, because I find that, and most functional medicine doctors will find that there's so much else that needs to be handled before the person has realistically enough energy to pursue an exercise program. So first we really have to look at getting some weight loss going, and in most cases adjusting the hormones and doing some detoxification and nutritional support before they even have the energy to embrace an exercise program. So let's go on to some hormone balancing. Now, that's obviously an entire webinar on its own, so I'm not going to go into a great detail here. But just back on that slide that showed what the major risk factors are for debility and death, we know that, for instance, thyroid, if it's too low or too high, it's very bad for the heart, and a person just doesn't have energy. We know with the adrenals, same thing. If you're just kind of always going on reserve cortisol and you're totally high wired, you could just collapse from exhaustion once you kind of hit the wall on that. And then when you do have a stress, whether it's a stress in life or it's infection or a toxin comes along or some sort of situation that would provoke cancer, you're going to have much less reserve to deal with it. With the sex hormones, we know that conjugated estrogens, which we don't use anymore, we use the bioidentical hormones, but estrogens have been associated with a 45% decreased risk of heart disease. We know that they can decrease plaque in the arteries by up to 50%. However, they don't seem to translate to an effect on decreasing stroke. It seems to be particular to the heart. There's a lot of other things about estrogens that are anti-aging. They prevent dry skin. They, to some extent, mitigate the wrinkling that's associated with age. They restore, to a certain extent, cognitive function and memory, and especially mood. And anybody who's been menopausal for a while without estrogen and then gets on estrogen can definitely testify to that effect. DHEA is a pro-hormone. It's not listed on this slide. It can go in many directions. It supports the adrenals, and it also supports conversion over to testosterone. And men, as well as women, do have a certain normal level of testosterone. And we know that it inhibits a certain enzyme that will impair how you deal with blood sugar. So even people who aren't outright diabetic have some things that we can detect on tests where they're not handling their blood sugar very well and they're not detoxing very well, and DHEA can help with that. The thyroid gland, sometimes we actually have to give somebody thyroid hormone, but in many cases we just need to supplement with vitamins. For instance, vitamin A is necessary for the brain to make thyroid stimulating hormone. Vitamin B6 is necessary for the tissues to convert T4 over to T3, and T3 is the active version. Vitamin C deficiencies cause an enlarged thyroid and possibly even hyperthyroidism, which once the thyroid gland burns out from being overactive from deficiency of vitamin C or deficiency of iodine, it goes down into a permanent low thyroid state. So between the vitamins and iodine, we can really go a long way to treating the thyroid, even if a person isn't quite at the point where they need thyroid hormone itself. Let's see, I'm kind of jumping around here. Again, I don't have DHEA on the slide, but we know that when the DHEA is too low in people women who are premenopausal, they have an increased breast cancer risk. Now, the postmenopausal age group is a little bit different. When their DHEA is too high, they have an increased breast cancer risk. And again, we get back to what is a functional medicine doctor? Firmly rooted in science, but willing to think out of the box. We definitely follow the lab tests of any individual. There is no cookbook. We appreciate biochemical individuality. Instead of just saying, for instance, DHEA is good for you, we don't do that. We say, no, let's look at your DHEA levels, look at your age, your menopausal status, your risk factors, and see what would be good for you regarding this particular hormone adjustment. Now, testosterone is an interesting one. As I said, there is a certain normal amount of testosterone in women as well as the abundant amount of testosterone in men. And in women, testosterone inhibits breast cancer cells through the testosterone receptors that they have. And it can also cause changes in sexual function and desire in men and women. And it can of course affect fertility. It can affect sleep patterns. Sometimes low testosterone is a cause for insomnia or sleep problems. There can be lots of physical changes, like men typically notice a loss of lean muscle mass as they get older. And even women may notice that once they get into their 50s and they're losing not only estrogen, but the little amount of testosterone they have, that they work out at the gym with much less effect on their muscles than they would have had when they were 20 or 30 years old. And this may be that they need a little help from testosterone. I'm not talking about turning anybody into Arnold Schwarzenegger. I'm talking about keeping people within physiologic range associated with optimum health. Another reason why we go by the tests. Low testosterone can be a reason for emotional changes, for mental function. The majority of the studies show that testosterone either has no effect on heart disease or actually lowers the risk of heart disease. There was one study that was just issued last week that shows that no, testosterone is bad for the heart. But I just want to tell you that the abundance of studies, the majority of studies, show that it's either neutral on the heart or in fact beneficial for the heart. 70-year history actually of some heart health benefits. Now, some people, especially people who are over 60, might benefit from growth hormone. It has tremendous actual anti-aging effects. Some people actually going from a walker to independent mobility, for instance. But that's an area that is a lot of doctors have less experience with, because there is some suggestion in some vulnerable people that there might be a slight increased risk of cancer. So some functional medicine doctors reserve the use of growth hormone to people that are of advanced age. That's not universal. You can find people using it on much younger people, but there is a bit of controversy there. Well, so much throughout this time I've talked about detoxification. I'm going to talk about it a little bit more in depth now, and those of you who have watched my last few webinars can there's lots of detoxification programs, but you know which one I refer to. This is a long-range deep tissue detoxification program called SonaPure, and the reason I endorse it is because it really gets at where the fats are stored, where the toxins are stored, which is in the fat. And this is an amazing statistic that was put out, that 41% of Americans are going to get cancer at some point in their life, and half of them are going to die from it. But the predictions for 2018 are the risk is going to go up to a 50% chance risk, and that is not okay. The most recent President's Cancer Panel report actually issued this startling statement, startling considering the conservative body who issued it, that the true burden of environmentally induced cancer has been grossly underestimated. And that is why in any functional medicine practice you're going to find that detoxification is always a big component of what they're offering their clients in order to reverse the damaging processes of toxins and kind of keep them from being at risk for these cancers that are striking the average American. One of the amazing things, like I said, about this President's Cancer Panel report is there were representatives on this panel from the Nuclear Regulatory Commission, the EPA, the National Institutes of Health, as well as major universities from coast to coast. So this wasn't some sort of fringe environmental group that was saying this. This is a very conservative group that for the first time since the President's Cancer Panel has been issuing reports actually came out and said that a lot of cancer is environmentally related. A great deal of what's out there in terms of these cancer-producing chemicals are what's called hormone disruptors or endocrine interrupters. And what they do is these are molecules such as what I have here, dioxin molecule, a side product of plastic production. Very, very water soluble. In fact, it's found in all water sources in the world that have been tested for it to date. And although it doesn't quite look like the estrogen molecule, it somehow responds to the estrogen receptors. Well, that does two things. It prevents normal estrogen from attaching to those receptors and having normal estrogen action. And some of these endocrine interrupters have some sort of twisted, abnormal pseudo-hormone function. So we find more and more children being born with ambiguous genitalia, which used to be called hermaphrodism. We find more and more 7-year-old girls developing breasts in first grade. In fact, the percent of 7-year-olds that are sexually maturing has doubled in the last decade, from 5% in 2000 to 10% now. That's for white girls. The number for Hispanics is higher, and the number for Black American girls is even higher. So there's something that's genetic. There's a genetic component to how we respond to these hormone interrupters. That's another reason why in a functional medicine practice and an anti-aging practice, one of the first things we look at is the hormones, and the nutrition, and then we're always right behind that looking at how do we get rid of the toxins. Just talking about breast cancer, because the current statistic is that 1 in 8 women is going to develop breast cancer by the time she's 85, is that 90% of breast cancers are environmental in origin. Again, this is a real switch from 3 decades of the experts telling us that it's your fault, you're too fat, you eat the wrong things, sorry, you have bad genetics. They're now saying, no, the majority of these are environmental in origin. So I do recommend the SonaPure program. It takes traditional sweat, which is the oldest known form of detoxification, and combines it with modern day science, particularly the use of niacin in support with essential oils, lecithin, and support of vitamin and minerals. But the basic philosophy there is that the skin is the body's largest detoxification organ. How do you get somebody to effectively detox through sweat? Well, you add niacin, which gets converted in the body into NAD. As NAD, this regulates the repair of DNA breaks, a major cause of cancer and inflammatory conditions and aging. It regulates the liver's detoxification pathways, and it's required in order for the body to convert foreign molecules, toxins, into a form that they can be eliminated through the skin, through the bowels, through the urine. And it also regenerates the body's main detoxification chemical, which is the body's own glutathione. It regenerates 70 to 80% of the body's main detoxifier. And there's lots of ways to handle the symptoms of toxins. And the Sonopure program is an entirely natural way, again, going along with the functional medicine doctor's philosophy, which is to work with the body instead of throwing a drug on the symptoms. You can recover, you can rejuvenate, and you can reduce risks. People who come in with all kinds of symptoms, and maybe they've had their hormones adjusted, but they still don't feel well, or their thyroid is treated, but they still have symptoms that sound very much like low thyroid. They have no interest in or enthusiasm in life. They don't have the vitality and the energy they once had. They still continue to have pain, breathing problems, allergy symptoms, poor sleep and poor memory, decreased mental acuity, some mental fogginess, even after we've adjusted other things. Or one common thing in my practice is people get on a weight loss program and then they hit a stop point. And at that point I say, time for detoxification. The body will not let go of the fat if it feels that it's holding on to the fat in order to protect the body from toxins. So in summary, an anti-aging practice is really better characterized as longevity support. And it's true health care, as opposed to what we've come to know as the health care system, which is really sick care. In an anti-aging practice, it's actually health care. It emphasizes pro-life supportive therapies, nutrition, hormone balancing, and detoxification. Now, an entire webinar on its own would be stem cell therapy, but since we cannot offer it widely in this country, it's still confined to research labs, although it is available in other countries. In the future, you're going to see that that's a huge component of anti-aging medicine is stem cell therapy. So that's what I have. Like I said when I started, each one of these components, blood pressure, overweight, blood sugar control, detoxification, could be a webinar on its own. So I hope I've given you an overview of what you could possibly get from an anti-aging or functional medicine doctor in your area. So I'm going to go to some questions now, which have been really piling up. Let's see. What kind of test should a weak elderly person take? Well, that is one exciting thing about this field, is that even 10 years ago, the test that we could actually do on people was very, very limited. But these days we have lots of ways to actually check a particular individual's adequacy of all of their B vitamins, their vitamin C, their CoQ10, their vitamin A. Now, conventional medicine doctors have caught on to testing for vitamin D. But hey, there's lots of other vitamins that can be tested for these days. So a complete nutritional analysis. We can even check for the adequacy of all your amino acids, essential, semi-essential, non-essential amino acids. We can check these days on a urine test for the adequacy of your fatty acids, your omega-3s, your omega-6s, omega-7s, omega-9s, your trans fats. This can all be measured. We can check for the adequacy of your detoxification, whether or not you're showing any signs of cell wall breakdown, excessive cell wall breakdown. We can even check for a metabolite that shows that you're crunching up DNA too much. So there's so much that can be tested for these days, and there's several labs out there now that will do this comprehensive testing. Now, you said it was an elderly person. Our government has not recognized the benefit of testing for a lot of these tests. So for Medicare age patients, we have some limitations. But these tests are now widely available, and we can do comprehensive testing to identify you as a biochemically individual person, biochemically unique, and we can prescribe a specific supplement regimen based on the test results for you. Of course, in any elderly person, I would also do a complete hormone analysis, and I would do a complete dietary inventory to see what can be improved there. I would also check for intestinal health. Is there yeast overgrowth, an imbalance of bacteria? Is there malabsorption? Are there specific allergies? each one of these things can lead to results that can give specific recommendations that can definitely help a person, but all taken together they can result in recommendations that would be one heck of a program to really improve health in that individual. Let's see. Are there any scientific testing standards for, quote, alternative therapies? This is an excellent question, and one that anybody who's conventionally trained to start with, as myself, has to deal with. I personally hold the alternatives to the exact same standards that I hold the conventional medications to. And, what is the proof? What do the studies show? What is the experience? What are the numbers? What are the side effects? Now, there's one caveat with that. When you're dealing with pharmaceutical grade drugs, you're usually dealing with a much higher risk ratio, and that's why anything that you require a prescription for in this country is by definition termed a, quote, dangerous drug, end quote, by the FDA. In other words, it's so potentially dangerous that you have to go through a physician to get a prescription. And as a doctor trained in conventional medicine with experience and additional training in the functional or alternative medicine field, I do both. If somebody comes in with level of blood pressure where they could just go right out there and have a stroke any minute, you bet I'm giving them a prescription. But I'm also loading them up with the nutritional support and dietary support and the things that I know have some science behind them. What I was getting at is the one caveat is with the nutritional support we have a much reduced risk. So we have a much greater benefit to risk ratio than we have with the pharmaceutical drugs, which, if they're prescription, by definition, they're, quote, dangerous drugs. So one of the things that we can do is we can be much more liberal with much less science in the field of nutrition and alternative therapies than we can with the pharmaceutical agents that have been demonstrated to have a more unfavorable benefit to risk ratio, if you get what I'm meaning there. Let's see here. Do I think that testosterone supplementation is beneficial for men? Well, the men that I treat definitely think so, and it's very subjective experience, but there's nothing like having improved vitality, improved muscle mass from the exact same workout they're doing at the gym, improve reaction time, decrease cardiac risk, and improve get up and go energy, not to mention sexual vitality. So it's much more than the press, and if you just type in testosterone to the internet, you'll find all the stuff about bodybuilding or sexual vitality. Well, that's definitely maybe part of the picture, but overall we just see a sense of rejuvenation. I think it's beneficial for men to have their testosterone replaced to a physiologic level. In other words, I'm not trying to make them, like I said, into a bodybuilder or Arnold Schwarzenegger. The range of normal testosterone is very, very wide, and I try to keep my patients toward the upper 75th percentile, in other words, the high range of normal. I don't go over that top number, so I'm still keeping them within a physiologic range, a very safe physiologic range. But do they benefit from it? Absolutely. What is the cause of vertigo? I'm sorry I can't answer specific medical questions, but there's lots of different causes of vertigo or balance problems or dizziness. Certainly we look at what's going on with the brain circulation. We look at the health of the inner ear and sometimes the middle ear. There can be lots of reasons for that. First, we have to rule out dangerous things that need immediate treatment, and then we would look at other things. And certainly some toxins can be toxic to the inner ear, which is served by a nerve that is directly connected to the brain. So vertigo is one of those things. You can just type it in the internet and find a list of about 100 things that cause it. Definitely needs an immediate medical workup to see if there's anything that has to be treated right away, and not finding anything, then you're safe to go off into the unconventional therapies on it. Let's see. Can I recommend, okay, if anybody has questions about recommending a specific doctor in a specific area, if you could just email the Building Strength webinars or me, then we can give you some more information on that. Do I think that red yeast rice has some memory effects on patients, the same memory effects as on statins? Well, red yeast rice has the ingredient in it that did make up Mevacor, which was one of the first cholesterol-lowering drugs. And anything that drastically lowers cholesterol can affect memory, and that's because cholesterol is the most prevalent organic molecule in the brain. By organic, we mean carbon-containing. And so anything that lowers the cholesterol too low could potentially have an effect on brain function. So I'm not a fan of lowering cholesterol to drastically low levels, as is currently advised by the national advisory panels, whether it's by red yeast rice or prescription Mevacor or Lipitor or anything else. Many people cook with olive oil. Is it best to use it? Olive oil is not a great thing to use in cooking that involves heat. It really doesn't take the heat very well. But in terms of using extra virgin cold-pressed olive oil on salads and in cold preparations, I think it's excellent. But it's just something that doesn't do real well with heat. But yes, monounsaturated fatty acids, you saw me mention it several times for several of these risk factors, can be very good for you. Any fat, of course, is going to have calories, so if you're on a calorie restriction, you're going to watch how much you use, but it is a preferred oil to use that has lots of benefits, and it's one of the main ingredients in the Mediterranean diet, which is a very successful way of eating. Well, that looks like it's all of the questions. Like I said, each one of these things that I've mentioned could be an entire webinar on its own. So I hope I've given you an overview of what you'd be looking for in a longevity support doctor for true health care and not sick care, which is these days this area is being called anti-aging and regenerative medicine. But like I said, I really like longevity support better, and I hope that I have the vitality of this person on my slide here when I'm another 30 or 40 years older. Isn't she great? Well, back to you, David.